Okay, whenever you're ready, the stage is yours.
Okay, good evening, everybody, and good afternoon if there's afternoon there. So, thank you for joining us today. Before I start, I really want to apologize because this session was actually slated for Sunday originally. So, I'm sorry for any inconvenience it may have caused you. Uh, so, let's just get into it. Before we start, let me just ask you a simple question. So basically, how many of you have checked your phone today and came across some kind of health advice? I'm assuming, if not all of you, a few of you or many of you may have come across some kind of health advice. It might be about diet, medicine, immunity, or supplements. So basically, today's session is about learning how to pause and decide, is this information a fact or is it fiction? So we're going to use a simple evidence-based checklist for that purpose. So let's just get into it. First things first, let me introduce myself. I'm Dr. Ahtisham. I have a master's in pharmaceutical chemistry, majors in drug discovery and development, and currently I'm working as a clinical pharmacist at MedCity International Hospital, Islamabad, Pakistan. So my research works include systematic reviews and meta-analyses on relevant research problems as well as several review articles as well. And currently I'm doing my molecular docking and cis protein analysis in my master's, which is almost getting completed. So why we are talking about this? As we are living in the age of information overload, health advice comes from social media, WhatsApp groups, YouTube videos, blogs, and even forwarded voice messages. The problem is not the lack of information, the problem is the quality of that information. When health information is wrong, the consequences can be very serious. People may delay proper treatment, stop necessary medicine, or even try unproven remedies based on what they have heard or what they have seen on the social media or even what their family members have told them. That's why we are learning how to evaluate health information, which is essentially a life skill today, and you must be able to evaluate that information. I'm sure you have heard these claims many times. Like every social media you open, there are several types of health claims. They often can come from friends or family as well, who genuinely want to help. But the issue is not the intention, the issue is evidence. Just because something is repeated again and again or comes from your family or friends doesn't make it true. Our goal today is not to ridicule these claims, but to learn how to calmly evaluate them. One of these claims include natural means safe, which is not always the case. But most of the supplements, most of the healthcare products, most of the nutraceuticals, basically they are marketized as natural means safe, and you don't have to opt for the allopathic medicine or other kind of medicine. So this is the sale pitch, basically, that natural means safe, which is not always the case. Testing is the key to safe supplements even. So we have to evaluate, and we'll learn how to evaluate them uh, in the future slides. Okay, you can feel results instantly. That right there, the underlined word instantly, is the real problem, because nothing at all uh, gives you relief, or you know doesn't take time. It always takes time. Real wellness, as it is written in the slide, real wellness always takes time. So basically look for clinically backed ingredients with recent studies. You don't have to jump on the uh, next best available product just because you want instant relief. It doesn't happen most of the time. The next health claim might be familiar. You might be familiar with is, if it's trending, it must work. Trends are basically are set by social media influencers. And what happens basically, the companies, the major companies, the industries, the healthcare industries, the pharmaceutical industries, they approach these social media influencers, and they're paid for that. They are paid for marketing, they are paid for their products being sold out. So even though they are not healthcare professionals, they do not make proper research, they do not get into it, get into the nitty gritty of testing and all that. All they are just getting money, and they're just marketing it. They're just telling the other people, telling their followers to try these products and promote these products without knowing what is the rationale, and what is these products are made of, and if there is proper testing being done or not. But of course, trends are gonna fade, but science still sticks. So always rely on science when opting for any healthcare product. When we are talking about healthcare products, mostly we are looking at supplements, nutraceuticals. So more supplements is equal to better health is never the case. Balance is the key. So always consult a healthcare professional to determine your individual supplement needs. In healthcare, we deal with uncertainty all the time. Some things are backed by strong evidence. Those are facts, of course. Some are clearly false. And you will see the signs once I tell you the checklist. You will see the signs in every healthcare information or a claim, that these will be more clearly, these are clearly false. So those are basically the myths. But of course, but many things fall in between. Research may still be ongoing, evidence may be limited or evolving. The danger starts when gray zone information is presented as a guaranteed cure. For example, if there is a drug in the pipeline and there's a clinical trial happening, and the company will start the marketing of that product even before it's gone through the clinical trials or human trials or safety or stability studies. So that is the dangerous part. So learning to recognize this gray zone is a sign of maturity, not weakness, basically. So you don't have to fall for those facts for instantly. Why information feels convincing? So misinformation works because it connects emotionally. There are different tactics, there are stories, there are fear tactics, and of course some of these claims, they give you hope. So stories are easier to remember than data, so that's why people just fall for the health claims even if they are false. Fear is also a factor that makes these messages spread faster. So when somebody shares a post with a fearful intention, that of course their intention is basically not wrong. They are sharing to and make other people aware of the danger of something they have learned. But actually it makes this message, even if it's true, it fear makes these messages spread faster. Hope makes them comforting. So basically fear and hope are, they go uh, along with each other. Also simple answers feel good, especially when diseases are complex. Not everybody has learned about these complex diseases. So when people are basically looking for these answers, what is happening to my body or something like that, and they don't want to go to a doctor just because they are fearful of the diagnosis they will get. So they'll just simple answer they just seek simple answers. So that's why they feel good, and they, especially when diseases are complex. Sensational headlines, of course sensationalism is one of the major factor that people are falling prey to this to these health claims. So sensational headlines are designed basically to grab attention, not to educate, but to grab attention. So understanding this balance will help us become more compassionate and less judgmental, because people are, if they do not know these tactics, or they just want simple things, they fall for the misinformation. So what is the real world impact of this misinformation? This is where the consequences become serious. People may stop taking medicine because they read something, or because they read something online. Others may spend large amounts of money on treatments they didn't, don't even work, just because the social media influencers said that use this nutraceutical product, use this uh, beauty product, even cosmetic product, but they don't work eventually, and that just breaks their hearts, and empty their account. At a broader level, misinformation erodes trust in healthcare professionals as well. So basically, what people are, when people don't see results in those products, they will blame those healthcare professionals and healthcare system, even that there will be a distrust uh, for the future. Once that trust is lost, even correct advice may be ignored. So do you need to be a medical expert, basically? So many people think, I'm not a doctor, so who am I to question this health advice? But the truth is, you don't have to be an expert in healthcare knowledge. You just need to ask the right questions. So basically, critically thinking is not about knowing everything and knowing the medical terms, the right medical terms, and everything. It is knowing what to question and what to believe. So, and fishy and false claims have the telltale signs, which we will discover in the next slides. So basically, when we will go through this checklist that I've prepared, so we will see that uh, these false, these fishy claims, they have the signs in them for us to elucidate. Okay, this checklist that I've prepared, in the evidence-based checklist for health information, this checklist is not complicated. Think of it as a mental safety net. Before believing or forwarding a health claim, you just have to pause and quickly go through these questions. Even using half of them is better than using none. You don't have to memorize this list. You just go through these once, and you will remember in the future what to look for the next time. So the number one is basically, who is the source? Always start with the source. Who is making this claim? Are they trained person? Can their qualifications be verified? Being confident, popular, or well spoken does not equal being correct. Being a social media influencer does not mean that they have the uh, proper knowledge to share those information. Reliable sources are transparent and accountable. So you just have to verify the source, where it is coming from. Just in case, if you're looking for some medical advice, you should, if you read something uh, on the social media, you just have to go back to the source, go back to the studies, go back to the uh, websites that provide this data, that the literature that they have. If the claim is correct, then you make the decision if that is correct. You don't have to then rely on that information. You have researched that part. Okay, number two is what evidence is given. Look for evidence, not opinions. Are real studies mentioned? Are credible journals or organizations cited? Personal stories can be meaningful, but they cannot replace scientific evidence gathered from many people. So basically, always focus on the evidence. What evidence is given? Just don't fall for the uh, health claims without any proper source or without any proper evidence. Number three, number three question: is it too good to be true? As I said, there will be telltale signs along the way when you make these claims. So there is always something fishy about the claim, if it is false. There are none of the miracle cures. There are no instant results, and there's nothing in the world that doesn't have side effects. So basically, side effects and adverse effects are two different things. Side effects are basic. They can't be, they can be and they cannot be, they may be or they might not be uh, dangerous or adverse to your body. But adverse effects are always bad. They always have a negative effect on your body, on your regimen, whatever you're following. So when something promises instant results or claims to cure everything, pause. In medicine, benefits usually come with limitations, and perfection is rare in this case, in medical, of course. So always look for those signs, and don't follow the snake oil merchants. Snake oil merchants are basically are the people who sensationalize the medicine, who sensationalize the healthcare products. Snake oil merchants, basically, this term it originates from medieval times when people used to sell snake oil just to relieve arthritis or something like bone diseases. So the this term comes from that time, and it happens today as well, but in different names. In pharmaceutical industries, they do that. They basically promise miracle cures, instant results, and with zero side effects as well. So you just have to be patient. As I said, pause and decide. Number four, are risks mentioned? Every effective treatment has potential risks. So, honest information talks about who should be careful and who should avoid it. If risks are ignored completely, that's a warning sign. So, always follow. If certain medication, if certain healthcare product, or if certain health claim includes risk, or it just doesn't talk about it, if it doesn't talk about it, it most probably is hiding something, or is it is just fishy in its nature. Is there scientific consensus? Science moves forward through agreement across many studies, not single headlines. So trust recommendations supported by multiple studies and respected health organizations. If just one clinical trial is available for something, of course that clinical trial may have addressed the side effects and adverse effects, but there's an also a possibility that it may have uh, skipped those, or just doesn't talk about it. So you have to what you have to do is look for the similar studies and multiple studies in that healthcare niche or healthcare claim that you're looking for, and always find something uh, that resonates with that study. So scientific consensus is very important. Number six, is someone selling something? So that is basically uh, an alarming situation, because everybody is selling something on social media when it comes to health claims, healthcare medication, and nutraceutical products, and supplements, and even pharmaceutical products. In a way, they are basically selling to their clients, and they are making money. So business works like that. You have to make money in order to grow, and in order to achieve something, achieve their goals. So they are selling something. It's up to us to recognize that what they're selling is uh, purchasable or not. So if there is a product at the end of the message, be cautious. Financial interest can influence how information is framed. Ask yourself, would this message exist if nothing was being sold? I highly doubt that, because financial aspect of it, it just incentivize the whole process of marketing, the whole process of selling something and selling the idea of something. So always be cautious. If someone is selling something, it is in their benefit, but is it in our best interest? Then comes the language matters. Scientific language will always be cautious. On the other hand, Misinformation is dramatic in its nature. Science always use careful language, and or misinformation on the other hand uses emotional and absolute words, like I just talked about earlier in the session, the word instantly, rapidly, or miracle cures. So these are the words that play with your emotion, and people get attracted to those if they're not in the healthcare uh, field, or even if they don't know these words. So pay attention not just to what is said, but how it is said, how it is conveyed. So always, language always matters. Number 8, and the final thing is the information current? Check dates, medical advice always evolves. So basically, medical advice changes with the new evidence. What was acceptable years ago may not be recommended today. New things and new treatments, new medicine always are coming and always are the in the pipeline. So always check dates and sources. If something is outdated, you don't have to follow these. Of course, if you're familiar with antibiotic resistance, so you may be a little bit aware of the information that every year there are multiple antibiotics introduced, just because the overuse or misuse of antibiotics is being one of the major healthcare crises. So always uh, go for the current information. How can you check if something is up to date or something is in the current information? So you can always check back and to the source, to the evidence, like I talked about in the earlier slides. Always look for the evidence, always look for the source. That's how you check if something is the current information of something. So applying the checklist. So we'll just go through all of that uh, with this claim. This herbal product, this can be any product, we're just making an example of it. This herbal product cures diabetes. So basically, this is a claim, this is an example of a claim that this herbal product A, for example, cures diabetes. So how would we move forward to this? How can we apply the checklist to this claim? Let's do a recap of the entire checklist. This is the part I want you to actually remember and use. First, who is the source? Always check who is making the claim and whether they are qualified and accountable. So there's no source here, but of course you have to look for the source. If this is this particular information, this product A, for example, you have to just go to certain website, go to the source if there's a source mentioned in it. And if this product A, if you search for it in the Google Scholar, maybe Google Scholar is a platform for medical studies and literature. So basically you have to just uh, type the name of, in this case, product A, and you will find if there is a solid evidence in that website. You will find multiple studies on that, because it's not possible that there are not multiple studies about something, about a new drug, if it is in the market, and if someone is talking about it and someone is marketing it. So it has to be, there has to be studies about it, there has to be proof about it. So that covers our second uh, checklist as well. Second was, what evidence is given? Look for real studies and data, not just personal stories or testimonials. So for example, so in social media nowadays there's a trend to follow reviews. If you're shopping something, if for example nutraceutical products, because these products uh, people make these big and large uh, claims about those, and they post certain testimonials and post certain reviews, and most of these reviews are fake, or they're just paid reviews. They pay certain companies, they paid certain organizations to post some of reviews and testimonials on their websites. So these are not reliable data. Reviews, they can be helpful in some way, But of course, most of these, I'm not saying all of these, most of these testimonials and personal stories that are just not reliable, scientifically speaking. So, third, is it too good to be true? Be cautious of miracle cures. I'll repeat it, be cautious of miracle cures, instant results, and claims of zero side effects. That right there is a trap, and you don't have to fall for that. Fourth are risks mentioned, as I uh, mentioned in the last slides. So basically, diabetes is a big problem. It is one of the uh, most rampant epidemics in the whole world. So diabetes is, if someone is making a claim about diabetes, about curing diabetes, you have to be very cautious of it. You have to be very careful what you're using and what you're gonna decide about that certain healthcare claim. So, are there risks mentioned? Always go for that. Always uh, search for the side effects, adverse effects, and the risks involved in that treatment, involved in that information. Because reliable health information always discusses limitations and side effects and who should avoid the treatment. Of course, not every treatment is for everyone. Okay, so you have to consider that before everything. Fifth one was, is there scientific consensus? So one study or one expert is not enough, as I uh, talked about earlier. So who should avoid that? So always, always look for agreement across multiple studies and trusted organization. Sixth one is someone selling something. So always focus on financial interests, because that financial interest doesn't benefit you, it is benefiting them. So always look for that. Don't automatically uh, fall into prey that but they actually do require extra caution, because of course is someone if someone is selling something, it is not directly in your benefit, financially speaking. So, seven, does the language and sound scientific or sensational? So, of course, li- uh, listening to it or even reading it on social media, it just gives you a little bit of idea if something adds up or something is of scientific knowledge. And if something is sensational, if something is fishy, you will have some sort of uh, vibe, I think, to it. So careful, be balanced wording you usually signals credibility. So always look for that. And finally, is the information current? Medical advice evolves, so always check dates and relevance, as I said earlier. So look for diabetes cures, diabetes. If there are new cures, which is highly unlikely, that like there are multiple uh, studies going on, there are multiple in the whole world, there are everybody in the scientific in the field is working to towards something like that, but it is not happening anytime soon. If it has happened, it does not go through the whole world like overnight. It takes time, this whole process takes time. So always if a claim fails several of these points, it is always best to pause, verify, or simply not share it. Because if you're sharing it without proper uh, sources verified, without proper evidence verified, without it having any scientific background, any consensus on that level, you're just trapping other people in the same trap you have been trapped. So basically, to conclude, remember that skepticism in this case, in basically healthcare information, when you receive some healthcare information, skepticism is always healthy. Asking questions, it protects lives basically, and sharing responsibly is a form of care. Good science is careful and honest. Misinformation, on the other hand, is fast and loud. So, learning to tell the difference is one of the most important health skills today. Thank you. Thank you all. And I would be very happy to take your questions now. Feel free to ask questions kindly.
Okay, thank you so much for that wonderful presentation. If we have any questions, could we please have them in the chat box for the speaker to answer? If not, are you able to see the chat box? Okay, no worries. We have a comment from Mariam. She says that it was a very, very enriching presentation. So thank you so much for taking out the time to being here with us today and being a part of STEM Quest 3.0. We have other comments saying thank you. With that being said, guys, if we do not have any questions, I can go ahead and conclude the session. Okay, it seems like we have no other questions. Thank you so much, everyone, for attending today's meeting, and I will see you in